Hi everyone. So this is back of us again. I think we started this series almost a year ago now, or less than a year ago, coming to a few months. So we also can't believe that it's been a year of this. And congratulations to everyone who started as an F1. You're probably going to be taking the PSA soon, so we thought this was the best place to start with. We do hope that this one is maybe a little bit of a more relatable one because I attended the Mind the Bleep ones last year, so I don't know how they are this year, but it was more tailored towards medical students because they take it in their final year. And also a little bit more of a slower one because they do one webinar for every single section. There's almost 6 to 7 sections in the exam. So it's a bit slower, and we are going to go a little bit faster and put out realistic tips and tricks that worked for us because we are working full time and studying for the exam and giving it whilst working, as opposed to medical students who have dedicated time to study for it. So on that note, you can, one, ask for your exam day to be off already with study leaves. You should already have done that, and if not, then we will tell you a little bit more about that when we get to the day, and to ask for study leave for it as well to study. F1s don't get formal study leave. It's very deanery and trust dependent, but you should get at least 1 or 2 days if you do ask nicely and try to check around, because if there is an opportunity to do that, why not? So I'm Disha, one of the F2s, and we have Mira and Sruthi with us. And yeah, let's go. Oh yes, and please fill in the feedback for us, and obviously, like Eddie said, for the other one if you need it as well. So just to quickly go over what the exam is, it's called PSA, Prescribing Safety Assessment. The exam is actually developed by pharmacists mostly, as opposed to medical doctors. So that's why it's very specific on its pharmacological style of questions and asking very specific calculations for prescriptions and very specific indications for prescriptions. And that's why they want us to use BNF or Medicines Complete every single time to refer our decision of prescription, which is what you should ideally be doing in practice. Now, that obviously doesn't happen in every single situation, but that's the most ideal situation, especially what good medical practice recommends from GMC. So that's the idea behind the exam. And then requirement-wise, you do need to pass it to pass F1. So you do get 3 sittings in F1. Ideally, you should pass in your first. My recommendation is the reason for that being so that you get the stress out of it. So this should be your priority going on forward from now. The exam is in less than a month. And everything else in F1 you can learn later after the exam. But if you get this exam out of the way, you're just going to have sort of a better time because you won't be stressed about it. But having said that, let's just say even if you don't get through on your first go, because a lot of things happen, including technical issues, and you don't get to sit the exam in this go and you have to do it the next time, it's not the end of the world. That's why you get these 3 attempts. So ideally, you need to pass it before the end of F1, which is in a year from now, to get your certificate and move on to F2. And then sometimes standalones as well have the situation, but we're just going to focus on our setting.
So your foundation school is ideally going to register you to the for an account, which is the Prescribing Safety Assessment. So you should have access to it already. If you haven't, you should in the next few weeks or days actually, and they would be emailing you to activate the account. The website itself is really great to just go through what the exam is like. They have about, I think, 3 mock exams if I'm not wrong, and if you time yourself for those exams itself, it's exactly the same format of how the official PSA would be. So I'd suggest if you time yourself and just go through that exam, you can kind of get a real-time experience of how the PSA would be. And I think the first date is Tuesday, 10th of September. You also have other 2 dates, which you would be they would be releasing later on. And like Disha said, you should be aiming to pass this exam on your first sitting. It would be easier because that would be IMGs taking that exam. And it's also based on your passing curve of the year. So depends on how many people get the average, and that's how they decide the passing mark. So if IMGs are taking the exam, it would be you could consider yourself at the same boat, I would say. That's what I've realized from the first exam itself. It was doable for most of us. So aim to pass it. It should be your first priority going forward. And I think daily practicing for about 2 hours, just getting accustomed to BNF, would be really helpful. It's an open book test, sort of, but we would not suggest just completely depending on the BNF because there's a bit of a time constraint. So just have it in the back of your mind that you need to know certain basics that you can just go through without checking on the BNF, but you do have BNF if you need it. Yeah, that's all I think about basics about PSA.
So now let's move on to the structure and the format of this actual exam. As you can see, there are 8 sections in this exam, 60 questions, a total of 2 hours with 200 marks. The questions will range from, as we can see at the top right, medicine, surgery, elderly, geriatrics, peds, psychiatry, obs and gynae, and elements of GP as well. So let me give you a very brief one-line explanation of each of the sections, and then later on we will go together through an example for each of these sections for you to get a better picture of how it actually looks. So the first one is prescribing. Disha, if you could just move on to the next slide. So if you can see here on this graph, it shows that prescribing has the biggest percentage in terms of scoring. And so your priority is to make sure that you score as high as you can in the prescribing section and try to go downwards from there. This graph really shows you where your priority should lie. Going backwards. So the prescribing part, it's usually something like they'll give you a question based on any particular scenario. Usually they'll just ask you, okay, this patient came in with this. What is the best appropriate drug to prescribe? So you'd have to give the drug name, dose, frequency, duration, just something like that very quickly. The next one is prescription review. This one, in my personal opinion, is a little bit lengthy because they usually, the situation is not the issue. It's just the fact that during the options, there's about 8 to 10 drugs that you would have to go through. So what they do is they give you the name of the drug, the dose, and the frequency. And the question can be something like, which of these medications should be withheld because this patient has been started on a blah, blah, blah drug, or which of the particular drug can cause side effect of GI bleed, something like that. So it would be good to have some sort of general knowledge of the classification of the drugs as well as the side effects that it can lead. You don't need to know specific, but at least if you have this idea of, okay, NSAIDs can cause this, 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 ACE inhibitors can cause this, 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 it will help speed up things, because the biggest thing, or at least one of the most important, arguably the most important factors to really acing this exam is not entirely just knowledge, but it's also your timekeeping, how well you manage. Although it's an open book, it is a little bit tedious to go back and forth BNF, and it's not like it's right there. It explains the answer. You really have to read through some things to get out the information. Moving on, it's section 3, planning management. This one, it's basically assessing your ability to come up with first the differentials, and also to some extent be able to diagnose and also understand the cost of management for any particular scenario that they put out. The question usually includes the presenting complaint, the examination, and then the blood results. And then they'll say, okay, with all of these information, what is the next best course of action, basically. The fourth one is providing information. This providing information or communicating information. They usually, again, will give you a scenario where the patient either may have been started on a new drug or some sort of combination drug, which may have caused a reaction. And it is your job to identify to see if there's any precautions or something that the patient should be aware of whilst being on this drug. So that's why it says providing information. So you're basically providing information for the patient. The next one is calculation skills. Some may argue that this is one of the most trickiest ones, but in my opinion, if you are able to understand the formulas, because they're quite repetitive, and understand how they actually use the formula in the questions, you understand that almost all the questions are quite similar. They just twist and turn, but the formula that you use is pretty much the same. It doesn't hold the biggest value in terms of points, but it's good to try to secure as many points as possible in section 5, 6, 7, 8. Even though they are small sections, they're considerably easier compared to section 1, 2, 3, and 4. Moving on, it's section 6, adverse drug reactions. It basically is what it stated. It's to identify whether you are aware of the adverse reactions that a particular drug can present and what the body's response is. That's pretty much it. Section 7 is drug monitoring. So this one, it's more about, it kind of intertwines with section 6 and section 7. It's just to gauge your understanding about how the drug works and whether you know what the body's response is. We'll move into that later on, but it's something like, okay, do you know if we give this particular drug, are we supposed to check the liver functions, or should we monitor blood pressure, weight, something like that? And the last section is data interpretation. This, again, intertwining with 6 and 7, but it's just after knowing what you need to monitor, what you're assessing, you should be able to understand what the result is giving you, and then from the result, should you do something with the drug? Should you change the course of management? Should you stick to it? That's pretty much it. And Disha, if you could move. Yeah. So this is just to show you the percentage of each of the sections. So as I mentioned before, the prescribing and the prescription is the highest, but don't worry too much. If you feel that you're not so good in the prescribing and you aren't able to really secure the best answer, then try to work your way through the other percentages, because that also helps with your overall score. We can move on.
Okay, so this is a little bit of a live demonstration of the resources that you're going to have to use whilst giving the exam and hopefully whilst prepping for it. Whilst I load that up, I've sent a few links on the chat for you guys to just save and look through and browse. The first few are just information and resources. And then the last two are the BNF sort of websites that you're going to use during the exam and which you should use whilst prepping. So while I load it up. Okay. So I think, opened up Medicines Complete. Can you see it, Shruti?
Yep, I can.
Okay, sounds good. I can't see the chat, so just let me know if there's anything. So this is Medicines Complete. So you just literally type in Medicines Complete. And first the login website should pop up. So I can maybe try to sign out and just show from the beginning. I think this is how it's going to show. So you do need to set up a login. And I think it comes through once you're nominated for access. So that's the first thing you should ideally do if you already haven't, is get your foundation school to register you on the PSA register so that you get access to all the official past papers, which is one of the first links that I sent. I think it's this website. You need to get your foundation school to register so that you get a login, because once they register you, then only you will be able to sign in and get access to practice assessments. I can also see my official past paper. But we're not allowed to actually show them. So that's why we won't go through the previous past papers, but we'll go through the public ones. So that's this one website that you have to get access to. And there's official practice papers here, which you get access to once they register you. So that's one thing. And then the other thing is Medicines Complete and BNF. So Medicines Complete, you get this login once you're registered, and then you can make an account from your trust. And this is basically BNF, but on this interface, Medicines Complete. And then there's another one. Just a second. I'm gonna try to share the whole window because I think did you guys see the PSA tab that I showed? Probably not. Shruti, did you see that?
No.
No, right? Okay, so I think that went wrong. I'll show it again just at the end. So back to Medicines Complete. You get a login, and this is Medicines Complete, and then this is BNF. So when you search BNF, this is how it shows up. I personally liked Medicines Complete, and this is what I used during practice and the exam. One, because the interface is so much prettier than this boring one. And two, I found it easier to find the treatment summaries, but some people find BNF easier. So now I'm just scrolling to here and then click BNF. And then you get this access to all of this. So this is treatment summaries, drugs, therapeutic areas. What is most commonly used is treatment summaries and drugs. And I don't think you get much other questions. So going to treatment summaries, you have a list of sort of conditions that you need to know vaguely and know treatment summaries about. So what guidance we got, and which this is the suggestion we will also give to you guys going forward, is go through each and every treatment summary just to know how it looks like. Not to memorize it because you have access to it, so why would you memorize it? But just to know how it looks like. Because, for example, urinary tract infections, you should know sort of where you have to look for the answer. Because if you get a question, which we're going to go through for practice, you won't, it shouldn't be the first time that you open a treatment summary and you're like, oh no, where are the options and where are the answers? If you know that, oh, this treatment summary has a whole system for first line treatment, you know it's nitro. So if you know off the top of your head, great, and then you just come and search the dose. But if you don't know, if the question asks you something about UTI treatment, and you can come to the treatment summary, find that this is the drug, search up the drug's dose, and then prescribe it. But at least you know that that's where you find it. So that's one thing that we recommend. And then the other is obviously you can search things up as well. Urinary tract infections, you search, you get the treatment summary, and then you're here, and then you can scroll. But you should know both the ways of getting there. Familiarize yourself with all the different types of treatment summaries, and then start practice. So this is Medicines Complete, and it's the same thing in BNF, just in a different style. So there's treatment summaries A to Z, similar. Let's just go to even UTIs here maybe. So here, everything is on the same page, right? So I guess some people find that easier. I just like the interface of drug treatment, and then it's similar, but it's just a little bit of a different interface. I don't know if you can get the treatment summary here as well. So you have two interfaces that you can use. BNF is, I think, better for interactions. So let's just say, sorry, Medicines Complete is better for interactions. My bad. That's why I used it, because you can do warfarin and then interactions, and then now you type in every drug that you think they ask about an interaction. So it's let's just say, I don't know, and then so warfarin was the first drug I put in, and then I went to interactions, and now I put in another drug. I searched severe, so now I know that there's a severe interaction, and I can use that for my question base. That's why I liked Medicines Complete better as opposed to BNF, because here you have to go to warfarin, and then you have to search the interactions, and you have to Control F, Clone P, and then you have to find it. So I feel like that's extra steps, but personal choice. Both of the interfaces can have the same information. And back to PSA, this is the website that I was talking about. You get a login once your deanery registers you, and then you get access to official past papers. If there's any questions at all, which there are, so I'm gonna maybe stop sharing, or Shruti, can you just read them out quickly?
So I've been responding to some of them, but we'll just read it out so that everyone can know as well. You can Control F in the exam, especially on BNF. We suggest you do this. Just use the keyword and just Control F. The exam will be in a physical venue, so it would be ideally in your hospital, in the IT room, and it's monitored. What I did was I kept my exam as well as the BNF screen just side to side so that I could just navigate easier. Again, it's personal preference. You can keep it open.
Agreed.
And you do prescribe before you pass the PSA. Ideally, you do end up prescribing whatever you have to, but it's one of those preliminary prescribing things because only doctors can. So sometimes you do end up prescribing, but just refer to BNF if you're not sure, or ask your seniors before you prescribe, as you've not finished PSA. So if you're not a prescriber as of yet, but you can prescribe.
And someone asked if we use the book or we can use the app, and Shruti said it's deanery dependent, and that's true. Even though most deaneries, I think, only allow online access, some do allow the book, which we don't recommend because who is going to find the time to rummage through pages? But some of the books have some interactions at the back and a list of tables, which is only in the book version. So I took a book because we were allowed to use it and only used it for that table. But I think now all of the deaneries have phased out of allowing books, but we don't know about every single deanery. So just check with yours and ask. And if you're allowed to take a book, then take it. You can find it at any ward. Pharmacists love to keep it on all wards. Just take it for the day, and you should have it for the table. But don't spend too much time on it before. And the practice papers are on Medicine's Prescribing Safety Assessment website, the last one I showed you. So that's the one your deanery registers you. So you need to ask them to register you and give you access. Okay, should we move on? We will show you guys how to actually use this system sort of real time with questions once we do practice questions. So today as well, and we're planning 2 more sessions to go through the sections in detail, especially the one that Mira mentioned. The prescribing one is the biggest section that gets you the most points. So if you get all points in that section, you almost pass the exam, but that's not to say to not practice for the rest of them. So we're gonna do lifetime practice with questions and then show you how to use the interface side by side, how we would in an exam. So I know it's a little bit intimidating to just see it at first and be like, what is this? This is to show you that you should start getting access to this, because some people don't have access to BNF. Get yourself registered and start sort of planning it forward.
So what we would suggest to do is know some of the common conditions that you do end up experiencing or seeing in the hospital. Again, you guys are working, so you would be seeing real life examples of this. So you would kind of get in touch with what you do as first line treatment. So some of the basic things that we went through before the exam was heart failure, what management you do for that, STEMI, NSTEMI, anaphylaxis, that's a big one. You get a lot of questions about anaphylaxis, and asthma, COPD management, diabetes. It's a very big one, and they ask a lot of questions about the side effects and what causes hypoglycemia. So that's quite good to go through, as well as prophylaxis, VTE prophylaxis, VTE treatment doses. So in case of P, and let's go on to the next slide. They have given, Disha, next slide, please. So this is just a basic blueprint that's officially released by PSA. This is not a complete list of what would come up in the exam, but this is something you need to know. And you need to know more than this, obviously, but these are some conditions it's good to know about. So over the, on contraceptives are a good one. They ask you about what you need to tell the patient when they're on contraceptives. Also, P, what drug you would give after a patient has suffered from embolism. Also, some basic calculation skills they've given us about aminophylline infusion. So these are just basic things you can keep in mind, just go through as like a blueprint that you can just go through. Knowing about all of this would be helpful, but there's no guarantee, and they've mentioned this clearly that it could come beyond this, but it's just good to know as well. So it's a good blueprint to have when you study. So that's what I did when I was preparing for the exam. I just went through these basic things, and then I went through rarer things that might come, or might not come, but it's just good information to have, and you will use that knowledge later on in your clinical career anyway. So it's good to have a wide range of information, but definitely don't go about reading the entire BNF or like memorizing everything, but just the basic things it's good to have a good idea about.
I think I just want to add to this that, like Shruti said, this is a blueprint. So it's a very major guidance format to tell you where to start from. And I think that's fantastic of a resource, because sometimes especially coming from Europe where we have exams where we don't have guidance, this is a fantastic place to start with, because now you know what list of things you should start to read about, not study and memorize, but just read. So like Shruti said, contraceptives are such a big theme in BNF. They're obsessed about asking about them. You'll see them in your practice papers. And I think all of us remember on the exam as well, we were asked about at least 2 or 3 questions about it. So you can get a lot of points from it. So it's not that you have to memorize the whole section of BNF from that side, but you need to know where to find it. Most commonly occurring things related to it. So sometimes indications, sometimes the route, you do patches, you can do conversions. You need to know all of these things about where to find them. Again, this is a very busy slide and very intimidating. So that's why I sent you the link there as well, so that you can break it part by part and start taking it part by part. Another sort of point that I can point out as soon as I see the slide is intravenous fluids, laxatives, and analgesia. This is probably the most top 3 things that an F1 will ever do in their whole year anyway. Any one of you who have done ward cover on calls already probably know that that's the thing that they call you to prescribe anyway the whole day. Going down that line, sort of digoxin, asthma, dehydration, all of these things are common conditions that present to the hospital no matter the specialty. And you will obviously eventually prescribe them within your year, but it's good to know the general indication and where to find them on BNF. So this is somewhere where you should start your prep with. And then once you've familiarized yourself with, oh, these are the treatment summaries, this is where I can find it, then start going to practice questions. If you go into practice questions straight away, good for you. I mean, if you're brave enough to do that, but you won't really know what topics or where to start with by focusing on. Instead, you'll just sort of be lost. So that's why this is a really good blueprint. But like Shruti said, not limited. So this is not the only things that they will ask. They love thinking out of the box equally.
Also to add, they do ask questions related to children. So BNF has a separate performer for BNFC, which is the children part of things. So you get a lot of IV fluid prescriptions based on weight. Also, dosages are quite different with children. So make sure you're on the right dosing. So for children, it would be different. And they do ask quite a bit of questions related to children. And just thinking back on what questions we had a lot of IV fluid prescriptions, so just the combinations. So that's good to know as well. And basic treatments of like emergency situations, those also we've, I think, got quite a bit. And if you're going by what resources you should use, I think we all used different resources, but basically the PSA official papers would be the best one to go by, and then you just add on based on what is helping. I think we can go through what we've used later on after we've gone through the questions. Okay, so we'll just go through one of these questions. So you guys can open up the BNF if you have access to it and try and figure out what this question is, the answer to this question. So it's a 60-year-old woman is admitted to hospital with a 2-day history of left calf pain. She recently returned to the UK after a long-haul flight from Hong Kong. Her drug history is paracetamol. Left calf is tender and swollen compared with the right. Mild pitting edema around the ankle, and her weight is 60. INR is 1, the normal range is less than 1.4. Doppler ultrasound confirms the DVT in the left popliteal vein. So what is the prescription for the one drug that you would need to give to this patient, given that she has a confirmed DVT on Doppler? If you guys have any answers, just put them on the chat.
So it's a very busy and heavy question for your first ever question to be practiced on. And that's why we wanted to give that to you, so that you understand what the style is. Prescription questions, it says on the green sort of part, prescribing, that's the section of the exam. That's the biggest section. And you will have most of the questions like this, where you have to write the medicine, dose, frequency, route. People are already writing answers, great, but you guys need to give us the whole thing. So you need to write the medicine, the dose, the route, the frequency. And that's scary, but you have to write it. And obviously use BNF if you do have access to it.
Disha, if you can quickly just bring up BNF
Yes.
so that we can just go do this in real time.
Yeah.
So we've got some answers here, and some of you are right. The first line treatment is apixaban or rivaroxaban. So when it comes to prescribing, apixaban comes in 5 mg tablets. So when you prescribe, it would be apixaban 5 mg BD, because just check here if DVT.
So, guys, I searched VTE, venous thromboembolism, because a DVT comes under VTE, if that makes sense. So that's what you have to search with to begin with. And then we have, am I in the right place?
First, I think, yeah.
So I was in prophylaxis. That's already a mistake.
So you should go under treatment because it's confirmed.
And then you have to go.
Bleeding.
Yes. And then you have to
And
go.
sometimes that's the thing about BNF, they won't give you the exact thing. So you need to kind of know what you need to type, which is why we're telling you to just be aware of what the BNF is like. So the first line treatment is apixaban or rivaroxaban. So you'd be correct if you write either of this. And if you click on apixaban itself, you will get the treatment dose. So you would get how much you're giving. So again, don't go for prophylaxis, it's treatment. So that would be initially 10 mg twice daily for 7 days. That's after that, it would be 5 mg. And depending on whether the DVT was provoked, unprovoked, it would be lifelong or 3 months, depending. So they wouldn't go into that much detail. So all you need to know is what's the route. So here it would be PO, what the drug itself is, and how many, what the dosage is, and what the frequency is. So we'll just go at the answer and see what's coming up. So someone has asked what happens if you spell it wrong. So basically what happens in the exam is if you write in apixaban, it comes up with a few options. So you're not actually really typing. So you get a bit of options and you just click on the one that you think is right. So here apixaban 5 mg tablets, it comes in 5 mg, does not come in 10 mg, but the dose is 10 mg and twice daily. So this is exactly from the BNF. And when you type in apixaban, it comes up as apixaban 5 mg tablets already written for you. So you just click that option, write in 10 mg, write in PO, and then twice daily. This is exactly from the BNF. You could also use rivaroxaban. That would be correct as well. But every other option is not correct. You wouldn't give heparin. For DVT, first line is still apixaban. So you're just basically going on the BNF, finding what the first line is, and then clicking the dosage and writing it, because we wouldn't be remembering this off our heads if you've not been, prescribing every single day. So it is completely okay to go through BNF and just find the answers for things like this. But now you guys know what the dosage of apixaban is, so it would be a little bit easier. And I would just say cross-check your answers. If you already know, go ahead and prescribe it and just cross-check.
Then this is the question regarding prescription review. So it's the next, it's the second section. It's the next second section with the highest percentage. So like I said earlier, it is lengthy simply because there's so many drugs to look out for. But as I've also mentioned earlier, it's really good to have an idea about the classes of the drugs and the common side effects. That's what they usually ask. So let's just read through the question. 62-year-old man on the urology ward underwent left-sided nephrectomy yesterday for a benign tumor. This morning, he's not been able to pass urine and has had to be catheterized. The past medical history is right there. He's on the regular medicines that are listed on the right side. On examination, everything's quite well in terms of obs, but he appears confused and disorientated. They did an investigation for glucose and it was 6.3. So usually for prescription reviews, they have question A and question B. So for the first question, select the one prescription that is most likely to be a cause of his urinary retention. And for question B, it's 2 prescriptions that are most likely to be contributing to his confusion. Bear in mind, as I've made this mistake as well, sometimes I don't see and I don't catch on that question A may ask for 1 and question B may ask for 2, because I see so many options on the side and I instantly think, okay, I might need to pick 2 for each of the columns, but it really isn't. So just bear in mind that that's there. I'm just going to give you guys a few seconds to just list the answers down and we'll go through them.
Whilst we're waiting for everyone to write the answer down, just coming back to the last one, it was 10 milligrams twice daily. So you have to write the dose that the patient has to take at that one prescription. You won't write the total dose of the day, but 10 milligrams twice daily, because the tablet only comes in a 5 milligram tablet. So they have to take 2 tablets twice daily. So in this question, obviously, when you have the exam to choose from, you can just choose the tick boxes. But here, since we're doing an interactive session, just type it in the chat. For question A, you choose 1 prescription. For question B, you choose 2. So in the chat, just write A and then write which prescription you would choose, and then B, which 2 prescriptions would you use? And you can use the.
Should we just go through the answers then?
Should we give them a few minutes? They're going to take ages to search it on the BNF.
Fine.
And do you want to show BNF or do you want to just discuss? It's up to you.
Sure, BNF would be nice, but I don't have access right now.
Okay, I can try to load it up. It's up to you. We can go to the answers and then show them BNF.
Sure.
They can also be the same answers. They like to confuse you a lot. So A can be a drug that you also choose in B. All these people who've chosen terazosin for A, I want explanations. I want to see what you guys found in BNF for you guys to choose it. Because we're here to help, but like you have to use the BNF and then yeah. Mira, let me know when you want the answer slide.
I think we can give out the answers now, because a few of them have already answered. So I see that a few of you guys have listed down for A, it's terazosin, and for B, morphine and metal. I think there's some confusion with question A. The question states 1 prescription that is most likely to be a cause of the urinary retention, not a drug that would treat urinary retention. So terazosin, alpha blocker, would not be the cause. It would really be the solution in this case. Can we go to the next slide just for a bit? So as you can see, for the question A, the feedback section says urinary retention may be caused by morphine and other opioid analgesics, especially during the early post-op period. So it's good to keep in mind, like I said, classes of drugs and the side effects that they can give. Amongst the drugs that can give you urinary retention also includes anticholinergics, alpha-adrenal agonists, benzos, calcium channels, alcohol. So if we go back to that slide, just quickly running through candesartans, that's ARBs, unlikely. Antibiotics, unlikely. Dalteparin, also unlikely because that's anticoag. The next is metal, possibly, but still not in the section of high risk. Morphine, most definitely, because it's an opioid. Paracetamol, also unlikely, and terazosin is the treatment. So from that, just from catching or identifying the class of drug, you can eliminate the options instead of searching each one of them in BNF. It's just a way to sort of go through these prescription review questions much faster so you have time for the rest. And for the question B, it says 2 prescriptions. So there's 2 choices here that are most likely to be contributing to his confusion. Okay, so confusion. Again, the first 3, very unlikely to be giving any sort of confusion. And most likely in his case, the urinary retention is, the confusion is secondary to urinary retention. So immediately, because morphine is an opioid, we're going to think of it as one of the major causes of confusion in this selection of drugs. So we're going to question mark that. And then paracetamol and trazodone, again, very unlikely. So after eliminating, let's say even if you don't have the time or you don't want to just check through and you're not so sure about it, then you can just go back.
Sorry, my bad internet.
It's okay, it's okay.
Which one did you want?
This one. So you can just from not being too sure about whether metal is included, you know that there's 2 options and you've eliminated all the other possible options. Hence, metal will be one of it. Moving to the next part, I'll show you so this is the feedback. It says morphine and metal can both cause confusion and disorientation. The only other drug with a site of action in the CNS is paracetamol, but then again, it's very unlikely to cause confusion. These kind of questions, especially when you go through the practice papers, it's a very good example because some of the questions don't actually give you such a thorough explanation. It's really good to keep in mind, you don't need to memorize these drugs. It's good enough to know the classes and what they lead to. That's the kind of key point in prescription review. You really don't need to memorize the names. It's just how easily you're able to search it on BNF. You can either type in the class of drug, you can either type in the particular drug itself, and you just Command F, the side effect, and it will bring you right to the section, and you can just check.
And just to clarify, there's lots of confusion on how to search in the BNF. So this is kind of what we were talking about, that it wouldn't be exactly stated in the BNF like this is causing confusion. So that's something you would have to try and navigate. So in the case of morphine, we know that it causes constipation, which can lead to urinary retention. So what I used to do for the exam was, there are certain things, well, you can just directly eliminate when it's like sort of obvious, but otherwise go on to morphine and just Control F and check if there's urinary retention, and it should say that it would be there. So Disha has just shown you how to do that. It says urinary retention is one of the side effects. So if you go on to every drug and just Control F, search that particular keyword. So let's say metoclopramide, go to metoclopramide, Control F and put confusion, it would come up with something vaguely related to what it can cause. So it says drowsiness. So that's what we're going through. So there's no confusion, but drowsiness would also be, if the patient is drowsy, they're confused as well. So that's where we're kind of going with this. So it might not give you the exact word that they've been using in the exam, but this is sort of how we went through with side effects. Just Control F and just do this for some of the drugs that you're kind of confused about. So, I mean, I would be a little bit confused about anything that's anticholinergics. Would they be sort of giving confusion? So that's when I would search. But we know that Coamox would not give you confusion. So that would be lowest on your priority. So go through what is highest to cause this particular side effect, which is why we're telling you to have sort of a basic idea of what causes certain things, what the mechanism of action is, and then go about it that way.
I think I want to reiterate the same thing because everyone is asking it in the very like, oh, it's not written, but you also have to use elimination. Like Mira said, when you go to the question stem and you try to look at all of the options that you have, none of these other drugs are going to be causing confusion other than the other 2 that are the most likely. They're also, metoclopramide also has confusion as a rare side effect, which is, we don't really see that often now that we're practicing. But it's the most likely one as opposed to Coamox or Deltaparin or paracetamol. Like these will just never even think about causing confusion. So that's one place to start with. And then the other is, even though you're saying someone's confused the terazosin with the urinary, and all of you think that, you know, the possibility of doing that, that's a very common mistake. That's why they give you questions like this, to confuse you and make that mistake. But that's why this is where you have to be very careful. So in question B, you just have to use elimination and kind of go quickly. But option A would be the difficult one, because you can be tricked, even though you're thinking that, oh, they've given this option, they've given terazosin, oh, it's urinary, oh, I'm going to choose that. No, you have to read the indication. And obviously these things come with time, with clinical practice. So that's why it's a really good thing that you're giving this exam now. I think that's a really good benefit that we have as opposed to med students, because now we're practicing. So we're going to see these meds be put into place. If you see an end-of-life care pathway patient who's on metoclopramide or morphine on a higher dose, you're going to see these side effects. You're going to see what the relevance of these medications is with palliative and with opioid conversions. There is confusion in BNS, yes. Should we move on to the next question? If there's any questions, obviously, guys, just ask in the chat and we will address. So yes, this is the next question for you guys. We'll read it quickly and then let me know your answers. So highlighting the main points. We have a 22-year-old woman with a 24-hour history of lethargy, tiredness, anorexia, past medical history, type 1 diabetes, drug histories, Humulin, insulin, 20 units before breakfast, 22 units before evening meal. So quite a lot of dose for the whole day. On examination, drowsy, tachycardic, normal-ish, hypotensive, blood pressure raise, respirate, normal oxygen a bit lower. Urinalysis is ketones. So we have ketones in urine. We have glucose in urine. Weight is 60. White cells a bit raised, maybe a bit of infection, bit of a potassium raise, hyperkalemic. Urea is also raised. Capillary blood glucose is 28, so that's outstanding to me. That's the first thing that's going to make me think about what do we have to do about that capillary blood glucose in a type 1 diabetic. And then we have a VBG possibly. So we have a pH of 7.22. What do we think about this pH and what do we think about the diagnosis? I'm already thinking of a diagnosis with these sort of important information bits. We have a pH of 7.22. That's very acidotic, I would say. We have ketones in the urine, and we have a capillary blood glucose of 28. So this is something we can search in BNF about already. Beautiful. Everyone's written DKA. So she is very much in DKA. And these are the criteria that you have to meet in BNF to meet the diagnosis of DKA. She's been given a liter of saline over 1 hour. Select the most appropriate option. What are we going to choose? Are we giving her a MOX for her very mild infection? Are we giving her calcium resonium for her potassium? Are we giving her glycoside, metformin, or the soluble insulin? Beautiful. Most of the people have chosen the last option. And I think that sort of comes quite obviously because she's come in with the severe diagnosis of DKA. You can go to BNF and search up DKA. So it's going to give you the criteria and it's going to tell you how you diagnose it, which is with how she's presented. So ketones in urine, high blood glucose, and the acidotic metabolic acidosis with the bicarb and the pH. The best treatment for DKA is fluids and insulin IV, which is what BNF also says. The dosage is usually trust dependent, and I think that's also what BNF says, but this is the only option we have here anyway. What is the average time about spending on the question in the prescription and prescription review question? So we're going to come to the time division at the end probably, and towards the end of the section presentations. I think it's 2 hours that you have for the exam. Am I right, Shruthi? You have 2 hours for the exam. That's not a lot. It was not a lot for me at all because I missed. I think you have 6 sections. I didn't even get to the last section, and I was really bad at time management. So that's something.
On average, prescribing is where you would spend most of your time, but obviously don't get carried away. You still have the other sections that are easy marks, I would say, because they're just clicking on options. So that's kind of easy, but in average, you should be spending 48 minutes for your prescribing section. That's again depending on how confident you are with that section. Obviously, spend lesser time if you know how to go through that faster. But I would say 40 minutes more than that would be you risking not finishing the exam, and I think that would be really bad, as in you would not be able to get those easy marks that you can get from the other sections.
And the best way to get through that is by practicing. The more you know how to search the drug and probably the common doses and just anything that will help you become more used to the system will help you get through the prescribing section in time, so that at least you can attempt to do the last ones. That was a mistake I did, where I didn't even get to attempt the last section because I spent too much time on prescribing. Okay, communicating information.
So this is what you need to tell the patient before they start a drug. So most times the questions would be before they start contraceptives or things like that. So let's just go through this question. So 66-year-old woman returns to the diabetes clinic for review of her diabetic control. She's type 2 diabetes. She's currently on metformin hydrochloride, titrated up to 1 gram PO twice daily, and her HbA is 62. So it's not been in range after increasing metformin. She has remained hypoglycemic despite dietary modification, lifestyle, and intensification of the metformin over the last 3 months. She's advised to start adding glycoside, 80 mg/PO daily for her existing prescription. Select the most important piece of information that you would be giving the patient. So you guys can obviously go search the BNF or pop down any answers that you think would be the right one for here. Let's try and just navigate to BNF just in case on how we can go about this question as well. You're able to just switch back. So most of you've given the right answer. We'll just go through BNF just to see how we would go about this. So they have a very good section on the Medicines Complete where it says patient and care advice. So this is where you're going to be navigating for providing information. And they tell you that there's a risk of hypoglycemia. So that would mean the patient would have to carry some sugary treat with them just so they can avoid that. And this is written nicely in the BNF. You have this information. And what I think Disha also would agree with Medicines Complete. What we like about it is it's listed on the site. So if you just click on patient and care advice, it takes you to that section. You don't need to scroll through it. So this is a good example of how you would go through a question like this. Let's also just type oral contraceptives and see what comes up when you do patient and carer advice. These are very common questions we see in the PSA. Actually, they ask you a lot of questions about contraceptives. So this section is quite good to go through this treatment summary itself. And emergency contraceptives, I think we've got quite a few questions on that. Everything's listed nicely on the BNF. So if you just go through how do you go through all these things quickly, the least amount of time possible, I think you'd be doing amazingly in the exam. So this was just one example. But for the providing information, I think I found that part easiest, because you can actually just go to the individual drug and just go to patient and carer advice or side effects, and you would know what you need to tell the patient that they should be careful about. Again, sometimes they give you things that are relevant to the drug, but again, it's about more important what you need to tell them life-threatening wise. So I wouldn't be telling them information that is, well, it's a side effect, but it's not life-threatening. That's not the first information I would be relaying. So in this case, hypoglycemia is life-threatening. So we want to tell them that, yes, your sugar can go down when you are on this drug, and you would need to have some sugar on you at all times. So that's the answer, and most of you got it right. So well done.
I think we had a question or two not with this question, but just generally, if a medication says 7.5 to 15, would you prescribe 7.5, 15, or 10? I think it's very question dependent. I think we're going to do a few practice questions where there's a range that shows on BNF. So you just depends on the question stem, depends on what you give them. If there is no definitive answer, then the PSA format will accept any of that range because it says from this to this. So you don't need to worry about that.
You don't need to pay for Medicines Complete or BNF. That's completely free resource that everybody in the UK uses. You just have to make an account, register. So we registered with our trust emails, but I think it doesn't matter. So you can register now itself, go through BNF, go through how the website works. So yeah, it's free, completely free.
When we do the practice questions by section next week, maybe we can try to show you the interface, but I'm not sure if we can, definitely. If we can, then we'll show you how it is to navigate through the exam. When you get access to the system, you'll be able to do practice questions, which is exactly the same system. I wouldn't say it's the best one, but it's not the most horrible either. So you have, you see all of the questions that you've done, you see all of the ones that are remaining, you can flag questions, you can go back and forth. So it's not horrible, but it's not the best. So next question. This is just an introduction to you guys for a question from every section. So we've only done one question from every section. There's only going to be so many from each of the sections other than prescribing. So that first question that we did that everyone was a bit confused about is the most common section, which is prescribing. So we need to practice that the most. And that's what our next session is going to be. But these are just to give you guidance about this is how the rest of the sections look like. All of us have our favorites. You just need to practice as much as you can. So this is calculation skills, probably the most hated of all. And let's go through it. I don't know why I chose this, but 55 in ED requires a dose of Fruzi, 40 milligrams by IV injection to treat acute left ventricular failure. It's a very uncommon condition to treat it for. We just say heart failure. Fruzi injection is available in ampules containing 50 milligrams per 5 ml. Normally, you would never do this. The nurse would do it for you. But because this is a formal exam, you have to do it. So what volume of Fruzi do you have to give? Everyone's written the right answer, so it's 4 milliliters. The strength of the solution we've already been given, so we know that the volume required is 40 by 10, which is 4. This was rather straightforward and it's basic math. I actually did like these questions when we were practicing, but I think in the exam it's so stressful. So that's why it's really good to practice them, because once you've done them, you know that you won't get, there's only a certain amount of calculations questions that they ask. It's really not that many. It's only 2 marks as well. If you do them, you do them. If you don't, you don't. So it's a good idea to
And I
practice
think just to add, the calculation skills is probably the least helpful, like BNF, just the least helpful with calculation skills. You kind of have to figure that out from other resources, to be honest. Yeah, so it's a good section to practice, definitely, because you get a different sort of variations. It's never this easy. It can get really confusing, especially when it comes to like conversions of like opioids. That's a big one. So yeah.
You are allowed to use calculators, like Mira said. You see this icon in the top middle. It's a calculator icon on the interface, so you can use it on the system as well.
And you are allowed to take in your own calculators into the exam as well, so should be okay. Medicines Complete is a website. I don't believe they have an app, so it's just a website, and that's what you would be using for the exam as well. Yes, you can use your own calculator. You can bring in the calculator.
So yeah, that's why in real life you use BNF more, because it's an app, so you don't have to open up a website. But at least for the exam, you can choose it. We're not telling you to. You can use BNF as well because it's an app, so you can do it, but you can't use your phone on the exam.
These questions are from the official Prescribing Safety Assessment website, so the mock exams that they've provided for free. You can take in a pen and paper to the exam for any calculations that you want to do.
You do have to ask though, because I think paper they're a bit weird about. You have to ask your exam provider, you have to ask your deanery. And I guess maybe calculator also depends on deanery. Ours were okay, but the exam interface has the calculator, so you don't need to worry about that.
Can I just add that for calculators, most of the deaneries don't allow scientific ones, so you have to get the normal one. Just be aware of that.
Should we go to the next one?
Yeah, so this is just adverse drug reaction. So basically, what drug has caused this particular side effect or adverse reaction in the patient. It's a 36-year-old man who's come into the ED, has collapsed shortly following an IM injection of diclofenac, 75 mg for painful ureteric colic. This is not, again, something that we actually give for ureteric colic, but we're moving on from that. On examination, wheezy and breathless, heart rate is 112, blood pressure is 90/60. So what's the appropriate management for this adverse drug event? You guys can pop down the answer to this. Okay, great. Everyone's put down the answers. Again, let's go on to BNF just to, I know everyone knows the answer to this, but even then we'll just go through BNF just to make sure everyone knows. So this is anaphylaxis. First line treatment of anaphylaxis is adrenaline. So what I would do is just type in anaphylaxis directly. And then the first drop that comes up is adrenaline. So you can just click on that and it gives you the dosages. So this is where you can be a little bit, this is good information. Again, the dosage is given. They also give you the dosages for children. It's different. It's 300 for children, 300 micrograms. So again, if this question was in the setting of a child being anaphylactic, the dosage would be different. So I think you just go down a bit more. Disha, you would find, acute anaphylaxis. So you actually have the dosages for children 6 to 11, children 12 to 17, and then for adults is 500. So you guys were all right. This is how you would find the answer for this question.
And I think since we're on BNF anyway, I wanted to show about this because someone asked about opioid conversion. So that's a very hidden place, but once you know it, you know it. Go search it yourself and familiarize yourself. So you have to do opioid conversion. At least in Medicines Complete, this is how it shows up. When you do opioid conversion, it shows up, but it's not the best. And then it's under prescribing palliative care. And then you have to scroll to opioid analgesics, and then it's in conversion. So it depends what the question stem is and what they're asking you to convert to. But there are tables that you can convert them to from morphine to other medications, because sometimes, the patient's route is not okay. Sometimes they're reacting. So you have different options. For example, giving them patches and everything. They've asked about this before. So in a very hidden and weird place, but now once you know it's there. Okay.
So yeah, this was an anaphylactic reaction to the diclofenac. Again, this is not a route we use because for ureteric colic, it's PR. But for the sake of this question, the patient has got an anaphylactic reaction from diclofenac, and the treatment would be adrenaline. So the other options you can already sort of, if you're not clear about why certain things weren't used, you can sort of understand that, well, right now, even if the blood pressure is low, you wouldn't be giving any infusions or any fluids because that's not going to help. The patient is severely allergic to a drug, so you need to reverse that with adrenaline.
So you don't really need, so ideally, like Shruti said, you just do elimination and choose the answer and move on. You don't need to go to BNF and search the dose. We're just showing you because we want to show you, but you don't have to do that.
I guess in this situation, it was kind of obvious, but if it's for children, it's a bit different. So you would still have to go to the BNF. Otherwise, just remember the dosage. Again, it's helpful to know the dosages for children as well. But BNF has a good section on what the dosages are according to age.
So we have the next question.
So this is the drug monitoring section. When it comes to answering drug monitoring sections, a lot of it is a mixture of theoretical and also what the question's really asking. So let's just go through this one. It's a 51-year-old woman, presents to the GP with facial flushing, night sweats. Past medical history is hypercholesterolemia, irregular menses for 6 months, and she's on atorvastatin on 40 milligrams daily. A diagnosis of vasomotor instability associated with menopause is made, and she's advised to start treatment with estradiol for 16 days and the other drug for 12 days. So from that itself, it's got something to do with hormonal treatment. So theoretically, if you are aware of the side effects or the things that we should keep in mind, you can already eliminate the options. So the question states, select the most appropriate monitoring option to assess the adverse effect of this treatment. Sometimes with these questions, why they say most appropriate is because the options itself can be like two that is very closely tied, and it really, the way to choose it is to see which is most relevant and more important to the particular case. So just pop your questions down and then we'll go through it. It's also good to keep in mind that hormonal replacement therapy really does come up a lot. At least one question in these exams. I think Disha and Sruthi would agree as well. So it's really good to just go up to BNF Medicines Complete, just to get a brief understanding of what are the drugs and their dosages and side effects. Saves time. Disha, could we just, because someone's asked, how do you find this on BNF?
I think this is the one question where we wanted to tell them that BNF is also sometimes not helpful. I'll open it up and I'll show it.
It says, yeah.
Yeah. This is sometimes BNF is not helpful, and sometimes your clinical practice plus minus your general judgment should be helpful.
Yeah.
So we have, what was the one that they said? It's, let's do it. I think it's one of these as well. Yeah, but in any case, it's all of them. So yeah, we have a lot of information on BNF, of which much is not in use, even though they have a lot of pointers about the rest of the options. But I think you do elimination again here as well, especially because hypertension is mentioned as a side effect. I think that's a starting point. So you sort of have to navigate your way around, even though it's a monitoring question and a patient advice question. You have to go to side effects and then choose options. Cholesterol.
You also have to pick the option that is most risky for the patient, because some of you, I think, listed down cholesterol and also weight. But the thing is, something that's most risky and most putting the patient in harm would be if the patient develops hypertension rather than an increase in weight or cholesterol. So just a bit of theory and also just relevance towards the question and which one's more important sometimes. And bear in mind, this section is not always, the answer's not always on BNF and Medicines Complete. So yeah, the feedback here says it causes sodium fluid retention, which leads to blood pressure. So a little bit of theory as well. And the others, although you can argue that cholesterol and weight is listed as part of the monitoring option, just stressing on the fact that blood pressure is the one that is the most appropriate. That's where they catch us with the PSA. It's always the most likely, most appropriate and then you kind of like go into a confusion because you don't know whether it's A or B.
I think someone's asked the page again.
HRT question page once more.
Is that
So I searched up the medication. What was it? Estradiol hemihydrate, and it's just a brand thing because it's a mixture of uh, it's a mixture of everything. So all of the brands come under this, and then you have to do side effects. Obviously, it is a drug monitoring question. So my instinct would be to go to monitoring requirements, but this is clearly quite useless. So then you have to make your way through, like Mira
I
said.
mean, in an ideal situation, you would be warning the patient of all the side effects. But here the question is, what is putting the patient at risk, and what is something we need to be monitoring to make sure they're not developing? So in this case, it would be hypertension. So even though it's uncommon and quite rare, it's risky for the patient to be hypertensive, which is why we're monitoring the blood pressure. So that's the most, in an ideal world, the most important monitoring.
And I think, like Mira said, you and Shruti said, that you have to think of the clinical relevance of all of this. So now that you guys have started working, if you have a patient, not necessarily in ED, but anywhere where you see them, yes, you're going to think about the rest of the stuff for long term, but knowing that hypertension is actually a side effect, patients do come in with weirdly high blood pressures in ED, having recently started HRT. You do want that to be known as the most important thing. So you think about the clinical relevance always, like Mira said.
And this is the last section, data interpretation. It really is, the more you do the questions, the more you realize that the last two sections really intertwines. And sometimes, as we showed on BNF, it's not exactly like if we're doing a drug monitoring, the answer may not really fall into the drug monitoring section. It can be in the side effect, it can be in the patient information. So it's just get used to BNF, and then it will be much easier. So anyway, let's go to this question. It's the last question. 73-year-old woman presents to GP with tiredness, lethargy. Past medical history is angina and hypothyroidism. Her drug history is bisoprolol, levothyroxine, and in bracket, she says she reports that she is fully adherent to her medication. So we know that this is the dose that she's using daily. And the investigations say that TSH is 7.2. And the good thing is they've given us the range. So we know whether it's normal, high, low. Now the question says select the most appropriate decision option with regard to her levothyroxine prescription based on these data. So data interpretation is you see the case, you see the investigation, you see what they want.
Sorry.
You see what they want, and then you look at the option. Most of the time, it's either to discontinue, to stay, or to decrease, or to increase. It's either these options. So shoot your answers.
Shani, you're doing endocrine. How dare you get that wrong? And I think, guys, this is our last question. So by all means, ask us if you have any questions in the chat. We're going to do a little bit of an open Q&A and tell you a little bit more stuff after we finish this question.
Okay, so a few have already listed down the answers. Should we go through the answer? So for those of you who clicked 75, good job. For those who didn't, it's okay. It's a very confusing question. It's hard, especially given the fact that the option literally is like 25 micrograms difference. So why it's 75? Let's look at the feedback. Blood test shows TSH is elevated. So there is underactivity of the thyroid hormone feedback suppression. Basically, the medication is suboptimal. Therefore, levothyroxine dosage should be increased, but caution should be taken to avoid exacerbating angina. Usually, in clinical practice, you increase it not to 100 immediately. So we know that her current one is 50. The next best option is not going to be 100 because that's way too high and it's way too quick as well. So by understanding and eliminating F1, 2, 3, 4, the fourth option would be the best choice. So sometimes you don't have to be sure, you just have to know how to eliminate.
Agreed. And I think I want to add that this is the case for most of the medications where you titrate doses. So for example, antihypertensives also work like this, where you do this with bisoprolol or ACE inhibitors or ARBs, where you slowly titrate the dose up or down. You're never going to go from like 1.25 bisoprolol to 10 milligrams. What's the point? You have to titrate the dose. Slowly keep on doubling, adding, changing a bit. So like someone's mentioned, BNF says 50 to 200. You still have to use the clinical context. You have to titrate as needed.
Let's go on to BNF because they've actually written how you increase it in increments, even though they've said what the normal dosage is going to be. So in this case, I would just put in levothyroxine and then go into the treatment and see how much the dosage is. So you just go down here, you can see initially 25 to 50 once a daily and then adjusted in steps of 25 micrograms. So that's exactly what the question is asking. You don't want to be increasing in 50 because again, it will exacerbate and there's side effects for this treatment. So you're just increasing, seeing the response, and then say the patient is still suboptimal despite 75 after 4 weeks, you would increase in another 25 increments. So it would never be increasing 50. So that's also written in the BNF. So that's what they've essentially tested. So it's in the BNF. It's just they've just asked it in a different way.
So yeah, this was the end of practice questions as an introduction. This was one question from each section. It's probably a little bit overwhelming. If you guys are not overwhelmed, I would be surprised. We were definitely. This is a good time to start thinking about this exam, start preparing and designing your study schedule. It's probably going to be quite hectic because you're probably working as well. But that's why you start thinking about it now. As much as you can, whenever you can, try to take up prescribing jobs so that you're getting used to medications. Always look at the drug chart and the dose and the route and the prescription so you're getting used to drug names and indications. And these are the list of resources that we recommend, but obviously not limited. Personally, my experience was I started studying for it very late, so I didn't manage to use all of the resources that we've mentioned. My favorites were obviously the resource website, so Medicines Complete, navigating through treatment summaries. That was my number one. Number two was official past papers. So you get access to, I think, 3 official past papers that are updated and new to every year. So that's very good to practice with. And then my number 3 was sort of a mix of everything, but mostly Mind the Bleep and YouTube, on and off, like practicing questions and playing it in the background and doing random things. So I think those were my top 3. Off to you guys.
So I've also kind of followed what Disha said. The base would be your official papers and just Mind the Bleep was really helpful as well. I used Past the PSA book. I read it cover to cover. It was actually very helpful. They had a good set of side effects, everything listed, and they've gone through every section in detail. So if you wanted to start somewhere you like reading books, I do like reading books, which is why I chose to read the entire book, and it was really helpful for me. And I also did QuestMed, so that's a subscription-based website, and that was the most closest to the official exam paper itself. And it's timed, so you can actually time yourself and do that exam. And if you're scoring about like 80% or 90% on that exam, you can be kind of confident that you would pass the exam. And Geeky Medics was also helpful. Again, these are things that you have to pay for, so just go through the resource, see what's helpful for you and choose the best one. Obviously, don't just pay for everything and then end up not using it properly. But if you, I think I would definitely say QuestMed was more helpful than Geeky Medics for me, but I did go through both of them. British Pharmacological Society, BPS, also has some free assessments, so I didn't pay for anything. I did the free assessments. Those were helpful. They went through the section in detail on what can you expect and what kind of questions would come up. So that's also kind of useful. But again, stick to the basics. If you are short of time, don't go through all the resources and then confuse yourself. But a few resources are just listed. These are the ones that we found most helpful, and it's again tailored to personal experience. So use what works best for you. If you're a visual learner, definitely do the courses. And if you like reading, then definitely read the book. That was really helpful for me. I don't know if anyone else, you guys have not used the book, I guess. Mira, you have.
No, unfortunately, I think I used the least sought resources. I only touched Geeky Medics and the past paper questions. I didn't enjoy the format of the Medicines Complete, so I only stuck to BNF. I can't comment.
Ugly format?
I just got used to Command F, and it was just, I don't know, it was well enough for me to just associate it with it. It's quite easy. You just really have to play around with the Medicines Complete or BNF, and you'll really find yourself getting along with it. Geeky Medics was quite nice. I think there were about 500 or more questions. Although I think Shruti has mentioned the level of difficulty is not as close as the actual exam. It does give you a good start. And I think someone's asked, how much time do we need to prepare? I started almost 2 weeks before the exam, and I think I did 1 to 2 hours a day max, and that was enough. It's just, you just remember that the biggest things to remember is 1, time management. 2, the more familiar you are with the websites, the faster it is. And on top of that, the more theoretical knowledge you have behind it, you would see that some questions really do repeat. For example, contraceptives, COPD, fluids, these things are definitely going to come. So it would really help with your pace if you've already understood and memorized what are the possible answers. So it's really just a combination of all of that would definitely help you score better in this paper, I would say.
And someone's also asked if foundation schools allow Medicines Complete. Yeah, they do. It's the official, I think they've released the official statement that you can use either Medicines Complete or Nice BNF. Both of them are allowed. So it's really just preference. I think preferred Medicines Complete and Mira preferred Nice BNF. So both of them are good resources. It just depends on if you like a prettier, I don't know, interface. We just like Medicines, I think, Complete. With Medicines Complete also, there's some quirks. You can actually search interactions and stuff quite easily and just navigate into each section easier. So I think it's personal preference. You will have access to interactions, actually. That's a good question. Nothing is blocked. Everything on BNF is completely available to you during the exam. And for interactions, I don't know if you want to go into that, but you can easily just click on interactions and just add on drugs. On Medicines Complete, that's a good hack if you guys ever get stuck.
And that's something I don't think you can do on BNF. You have to go through every drug and search it. But it's the same thing. It's Control F and then you do that. So it's at the end of the day, I guess, the same thing. Also, this is BNF Children, so you can open the BNF Children from that side. Where did we go? So let's just say warfarin, like we showed before. You search the drug you need to do the interactions for, so that's a start, and then you do interactions, and then you're there. So you can either add in all of the drugs that you've been given, amoxi, what else, statin, and then you do search, and then you get a list of everything, right? So that's something we prefer in Medicines Complete, but equally in BNF, you also have that option in a different way. So you do the drug, and then you have to do interactions, and then you do interactions. That's it. That's a lot of clicking. And then you can just search everything from here, as opposed to adding every medication. So to each their own, whatever works for you guys. Can't seem to find the PSA bundle on QuestMed. Shruti, you have to take that one. I don't know, QuestMed.
I'm trying to find it as well at the moment, but I'm not sure. I did subscribe to it last year, so I'm not sure where to find it now.
And I think coming back to the use of Medicines Complete during BNF, you should be during the exam, you should be able to obviously, but also just confirm with your foundation school just in case. They should allow it, because when you have access to past papers, this is why this is so important to get access to the system now. They should be allowed to do that because it's less than 1 month. You get access a month in advance. It says that on the interface. So when you do practice questions, you have to open the Medicines Complete and BNF through the exam interface, not of your own, because in your own you do like your favorites and all of that stuff. You can't do that, so you have to open it through the exam interface. I can show you the drug interactions thing again. So in Medicines Complete, you do interactions checker. You can also go from here. Okay, no, you can't. So you have to go to BNF and then you have to open the interactions. So let's just say, let's try a different drug. Let's try ramipril, and then you do interactions on the left-hand side. And then you can search aspirin. I mean, I'm just adding drugs, so you can just add your meds. I'm on cardiology, so these are the only drugs that are in my brain right now. Mesoprolol. Then we search, and then it's telling us the interactions.
Also, just to answer the previous question, so QuestMed has actually changed the interface a little bit. So now if you go under clinical and MLA part of it and go under QBank AKT, you can actually get the 7 PSA test as well as other exam questions. So that's where you would have to access in QuestMed. So they've changed it this year. It wasn't like that before.
September 10th is the date for, I think, everyone, because it's on the foundation program website. But that's why you have to ask your deanery lead. So the person who sent you your rotations and has been in touch with you, you have to email them to ask you, when is our PSA? Can you register us on the system and get us access to past papers? And then you will know. Let us know if there's any more questions whilst we tell you about what our next session plan is. So we've basically given you a lot of advice and a lot of information right now, so take it all in. We wanted to get your feedback about when we should plan the next session. So we wanted to do 2 more. So we wanted to do session 2, which would be for the next sections, which we've covered, and then a last session on September 6th, which would cover the rest of the sections, probably go back to section 1 a bit more, and then an open Q&A. So let us know what date you guys suggest for yourselves, whether it's August 26th or 29th. All 3 of us are surprisingly matching to be available on both of those days, so we are happy to do it then. Obviously, this is all after normal working day hours, so this would probably be 7 p.m. UK time again, because that works for all of us. And then September 6th would also be the same 7 p.m. time. That date works for all of us. It's right before your exam, but also just enough so that you get some more self-study time before the 10th. So please let us know about August 26th or 29th now in the chat or in the feedback form that you'll get after at the end of this. Please fill in the feedback form. That's what we can use to prove that we've done this session. Hopefully that was useful. And we're still here to do more questions and answering. Yes, I can show the Medicines Complete again. The login, you do need to ask your deanery. And for Medicines Complete, I don't remember how I made my account. I think it was, I used my NHS email. So I think you need to do it from your trust site, I think, right?
Like just your trust computers. That would be easy. to do. That's how I set up my account, but then I'm accessing it on my laptop. We are all using it on our laptops. It's just for the initial registration part.
Yeah.
So I don't know we can add this as the non-core learning, because but you do get a certificate, so you can add that in. Just go on to your portfolio and your is that your hours, and then
I
you
would
just click on
suggest. Yeah,
non-core. I would add it in because you can add whatever. It's flexible. It's it's non-core, so it's not deanery related. So you can just add this in. You'll get a certificate when you fill in the feedback.
so I would also recommend to add it in because PSA is an important exam for you guys. So start using this for your course as well. Use this in your PDP that you want to learn for this exam and then pass it. Use it for your non-core where we've done this session. This is 1.5 hours. You can add some YouTube videos that you've watched and you can add Mind the Bleep. And then let's go back to this for the last time. So you search for the medication, and then on the left side you have the interactions. Wait, I did that wrong, didn't I, Shruti?
Yeah, I think it's.
Let's do it again. So BNF, and then you search for the medication, and then you do Why is it coming up like that?
That's weird.
Okay, I lost it. Okay, you can answer more questions while I figure this out.
So the login, I think it's the official website, which is the Prescribing Safety Assessment. They should be giving you that login soon enough, but no other resources that we've listed require the trust to give you a login. It's just the Prescribing Safety Assessment. That's where you will be taking the exam itself. That's the interface you'll be using for the exam. So they should be giving that to you soon enough, but you can reach out to them, ask them when it's expected, just so you can prep with the mock question papers.
I lost it. I don't know where it is.
So I think, Disha, what you're doing wrong is just click let's just do aspirin and just click interactions under BNF when it comes up. Yeah, on the side, just click interactions. Yeah.
See,
And then just
Shruti knows better. Yeah.
I've done this too many times.
Yeah. It's like muscle memory. Yeah, so you just search again. Let's do it again. Search the medication, and then you do left side interactions, and then you can add all your other meds. Takes a bit of time, but you get used to it.
So this feature is not there on Nice BNF. We're definitely not promoting medicines completely. We are.
Not promoted.
This is useful for Medicines Complete. It saves a lot of time. If you're going and just checking interactions for every drug, you can just imagine how taxing that is. It's really boring. So this is more helpful, and it saves you a bit of time as well. I don't know if you can have, I guess you can have both of them open, but it would just be confusing for you because you're navigating through 3 systems at this point. So I'd say just stick to one of it, but I don't think they have a problem with opening both of them. But yeah.
I think I tried to do that and that was too chaotic, so I don't recommend that. Just use one. Stick to
Someone
it.
said this was blocked for someone in medical school, it was blocked. So we're not sure about that. When we were doing the exam, it wasn't blocked. So I don't know if it's a new thing. It shouldn't be.
You should ask your deanery for logins to the PSA website. That's where you get past papers.
So again, it's trust dependent. So your first point of contact would be whoever the PGME is. So you'd be contacting them regarding.
You have to say what PGMA is. No one knows. Postgrad medical.
Medical education. So your medical education is essentially, yeah. So whoever the lead for that is in your trust, email them. They should be sending it out soon, actually, but if they haven't, you can email them about it.
You could also email the foundation program director, which is also listed on the Horus itself. So if you really can't get anybody to reply you, their email is listed on your Horus.
Did you have to do that?
No. But okay. My deanery just immediately asked us if we needed to do PSA, and we confirmed, and they did everything for us.
Fantastic.
We'll stay on for a few more minutes for last minute questions, but I know you guys are all tired post work or just tired. Let's wind up soon. Any final questions? We're happy to answer. Thank you everyone for joining. Please do fill out the feedback form. That would be really helpful for us. And that's also a good way to communicate with us with what you want to see in the future. And we'll try and accommodate as many sessions as we can, because I think we can only try and do 2 or 3, but we'll try and get how many ever we can. To register for Medicines Complete, I think just go on the website and there's a register button, right, on them. So that you just fill in your email address, just a normal register, I think.
Thank you very much, guys, for attending. We hit 120 attendees, and I think that's fantastic. But that's why we are announcing the next sessions now. Let us know which date works better for you guys. In the feedback form or here. We also would love to hear how this session went for you guys. Even though it was interactive, maybe do you want more interaction, more questions, more navigation through BNF, whatever it is, we'll try to accommodate.
Ideally, I think the next few sessions would be more interactive. We want to try and do that for the questions part of it. I think best way to go through these sections is just practicing questions. So feel free to definitely put in any suggestions you guys have, and really definitely want to improve on anything. So definitely put on anything, any comments that you have from this session, what you want to see in the next section. Yeah, definitely we'll take that suggestion. More questions, it would be more question based. This was just an introduction, so we weren't able to add more questions because we would run over 2 hours if we were going to do questions for each section. But like, we'll definitely do more questions next time, official questions and just questions from resources that we've used.
From what I gather, I don't think any of these dates now overrun with Mind the Bleep schedule, so that's a good thing. Number 1. And number 2, that's the plan to do for the next sessions, is only questions pretty much. We've covered all the basics of the exam and the tips and tricks we had to give to you, so we will just pretty much do questions, and that's also probably the best way to learn anyway. And let us know what we can do.
And you guys can definitely reach out to us on our social media handles if you have any other specific questions. And yes, if you guys are by any chance in any of our deaneries, definitely you can ask us about deanery specific questions as well. I think we should quickly say that I'm in East Anglia working at West Suffolk Hospital.
I'm right now in Thames Valley, who doesn't care much about the PSA, so you have to email them. And I'm now in Milton Keynes Hospital.
And I'm in the LNR region at the Northampton General Hospital.
Good luck for studying, guys. Thank you very much for joining. This was a fantastic audience. We did not expect 120, so well done, I guess. See you guys on probably the 26th. Based on feedback, we'll see which date and we'll send it out through Intermed. Thank you so much, Eddie, for putting this together as well. And yeah, good luck for studying. Good luck for F1. Good luck for your shifts. See you on the next webinar.
Please tell us what you liked or disliked about the video and ask any questions in the comments. If this video is useful, please give it a like. All links discussed in the video can be found in the description, and please use those links and subscribe to the channel to support us so we can keep producing content. Thank you, and maybe watch another video.